Thank you so much for joining me here at the live desk. I am Janae Hancock. As you can see here on your screen, it is World Lung Cancer Day. And since it is an important day, I do want to bring in an associate professor with the University of Kansas Cancer Center. This is Dr. Kishna Reddy. I want to thank you so much for joining me here at the live desk. And as always, it is nice to meet you here virtually.
Nice to meet you as well, Janae. Thank you so much for having me.
Of course, of course. And it is an important day, like I mentioned, as our viewers can see there on their screen. It is World Lung Cancer Day. And I do, before we hop into this interview, just want to announce some alarming statistics that I learned today. About every 2.5 minutes, someone in the U.S. is diagnosed with lung cancer. And every day, lung cancer takes hundreds of lives. And that information is coming from the American Lung Association. So right now, Dr. Reddy, I do want to bring you in, and I do want to ask you, who is mostly affected by lung cancer? What age range?
Well, lung cancer definitely affects everybody. It is a cancer that we do see more in folks as they get older, but it does affect people, really even as early as in their 20s. I've taken care of folks with lung cancer. Certainly, I would say the majority of patients with lung cancer are diagnosed in middle age or older. So again, age is a risk factor, and the older someone is, the higher the chance or higher the likelihood of diagnosis. But in some folks, for instance, even in folks who had smoked for years before and had quit for many years, sometimes they can get a diagnosis much later in life. So age is a risk factor, but as I said, we do see even young people and certainly non-smokers as well who can be affected by lung cancer. So I would say it really does affect everyone.
Yeah, so it really does not discriminate when it comes to lung cancer. Now, you mentioned young people and you mentioned smoking as well. I do want to throw this statistic out there as well. More than 2 million U.S. middle and high school students reported using e-cigarettes in 2021, and with more than 8 in 10 of those young youth people using flavored e-cigarettes. So should parents be concerned? Should they be having conversations with their children about the dangers of vaping? And if so, when do you think those conversations should start?
Yeah, I think that's a great question, Janae. I think that we're learning more and more year by year about all of the dangers that are associated with vaping. I think there are lots of substances, there are lots of things that can increase, the risk of lung diseases in folks with vaping use. And so I think it's never too early to start those discussions. I, would encourage all parents to have those discussions as early as possible. I think that a lot of people see, vaping as a healthy substitute to cigarette smoking. I think that there are certainly certain things, certain chemical substances and carcinogens that may not be in the things that people are exposed to when they're vaping, but there's other substances and other chemicals that they are exposed to. So I think that it's important to have that awareness that ideally, we are having these very serious discussions and really trying to cut down on vaping use and get folks to not, adopt that as a lifestyle habit and look at other things and other healthy habits.
Yeah, and so vaping is a very popular activity among a lot of different age groups. I do want to also ask you, what problems specifically can vaping lead to for just anyone?
Well, I think some of these things are becoming clear. As time goes on, as we get more and more information, vaping, if you think about it, really hasn't been around very long. But I think we do know that some of the substances in vaping and e-cigarettes do have the potential to cause injury to the cells within the lungs, and these kinds of things can cause lung diseases outside of even cancer, just other irritants, if you will, to the lung tissue and things that can affect someone's breathing and cause issues later in life. So I think that as with anything, as the more time passes, the more we're going to learn about, some of the dangers and risks of vaping.
Yeah, so a very serious issue, a very serious topic that we are discussing today, which is World Lung Cancer Day, for all of our viewers who are just now joining us. Now, for the people, or if someone is diagnosed, what is the survival rate of having lung cancer?
Yeah, so it really comes down to the stage of lung cancer. Our ability to cure lung cancer has definitely improved over time, but the statistics are still, pretty alarming. And especially when folks are diagnosed with lung cancer at later stages, it can still be a very challenging disease. With, current advancements, nowadays, the 5-year, overall survival for someone with, for instance, a stage 3 lung cancer is over 50%, which is, come a ways and improved quite a bit from what it was a few decades ago. So it is definitely making improvements, but we have a long way to go.
And speak a little bit more about the screening process if you are diagnosed or if you just want to learn more information, especially regarding family history.
Absolutely. Yeah, I thank you for asking that, Janae. I think that screening is a huge tool in our arsenal in fighting lung cancer. I think that everybody is aware of the fact that the earlier we can diagnose folks with lung cancer, the better chances we have of getting rid of the cancer and curing someone. And so anybody really, especially with a history of smoking, even a remote history of smoking, I think should talk with their family doctor, their primary care doctor about screening. A lot of people don't realize that a screening CT is covered by Medicare, covered by insurance plans, and again, can detect lung cancer in the earliest stages and well before someone's ever having any symptoms, which can really improve our chances of curing someone.
Yeah, and right now, I know you can't see it there, doctor, but our viewers are taking a look at video you all sent over of a person actually getting screening done as far as lung cancer. I also just want to ask you, at the beginning of this interview, I brought up some alarming statistics, and that information did come from the American Lung Association. Do you have any statistics regarding Missouri and Kansas as far as lung cancer goes?
Well, I think that the rates are a little bit higher than the average in the country. I am kind of guessing a little bit, to be honest with you. I know the rates of smoking in Missouri are higher than kind of the average for the nation. And so again, just knowing the correlation between smoking and lung cancer diagnosis is why I'm saying that. Definitely, I think, smoking and lung cancer is as much a problem in Kansas and Missouri as it is in the rest of the world. And I think, again, we have, great strides we really want to make in terms of helping our population here locally, in fighting lung cancer.
A very important conversation as well as very timely. Dr. Reddy, I want to ask you if you can just tell our viewers where they can find more information as far as if they want to come in and get checked out for lung cancer or if they just want to learn more information about it.
Yeah, definitely. First off, I would definitely encourage everyone to kind of touch base with their primary care doctors about screening. Definitely, I think that's the first place when it comes to getting set up for a low-dose screening CT. As far as getting information, definitely, I think we have some terrific websites through our University of Kansas Health System and the University of Kansas Cancer Center. And I encourage people to take a look at that as kind of the region's only, National Comprehensive Cancer Center here at the University of Kansas. We're really proud of our cancer program, and that includes what we really can offer for patients who are diagnosed with lung cancer. One of the things I just want to take a moment to mention today is I think this is an important day to honor everybody who has, gone through and fought with lung cancer and the sacrifices of people and their families as they're going through this. And I think it's through the contributions of everyone and through patients who've gone through lung cancer treatment, and especially those who participated in clinical trials that have led to everything we know now about lung cancer, and all of the advances that we've made in fighting lung cancer have really come from a lot of clinical trials and a lot of folks who've been so kind and generous to participate in those clinical trials. And at the University of Kansas Cancer Center, we have a lot of clinical trials available for patients across all cancer types, but lung cancer being one that I'm very involved with. I can certainly speak to kind of how many different opportunities we have in terms of different treatment programs and different clinical trials. So I think there's a lot of information people can get from visiting our website at the University of Kansas Cancer Center. And again, I think we're more than happy to connect folks with, resources and talk to folks about the different opportunities we have here if someone or someone they know is going through lung cancer.
Yeah, and Dr. Reddy, this sits closer to my heart because I did lose a family member to lung cancer. So I think it's something that a lot of people should just keep in mind. It's a lot of things that, you may not think about, and you just kind of go every day not thinking about family history or how you may be impacted. But anyone can be impacted, and like I mentioned, it does not discriminate. So I want to thank you so much for sitting down and talking to me on World Lung Cancer Day. This is a very important topic, and I appreciate your time.
Thank you so much for the opportunity, and I've really enjoyed talking with you this afternoon. Thank you.
Of course. Thank you so much. And as we continue to honor Lung Cancer Day, today is really supposed to advocate the need for more lung cancer research funding.